Going through chemotherapy, typically you're going to be extremely fatigued. We're going to look at a baseline of where your cardiovascular stamina is, utilizing some standardized tests on the treadmill or basic walking, and then we're going to outline a program for you to follow over the course of the administration of the chemotherapy. In women who need to have trimodal therapy, which means they're going to have surgery, that they're going to have chemotherapy, that they're going to have radiation therapy, once the surgeon has determined, along with the pathologist, what the subtype of cancer is, the medical oncologist is going to come up with a plan for what types of drugs are they going to use. For that, the side effects are numerous. Most people are familiar with the side effect of losing your hair or maybe some memory loss or some of those types of things. And most people don't necessarily think about the fatigue that's going to result because of the administration of that drug through your system. And so, as a physical therapist, I want to be able to prepare that patient to be as strong as they can be to enter into the process of chemotherapy and to be able to utilize exercise as medicine and adjust the dose and frequency depending on how far along they get in the continuum of the chemotherapy process. If you can find somebody who's been through the experience, who can say, this is likely what's going to transpire over the course of this experience, and here's how physical therapy can help you once you start chemotherapy. And if we're able to start early enough, we can get ahead of that sort of rolling ball of fatigue. So you feel like you have some quality of life while you're going through this. It's not chemotherapy, and I gotta lay down. And chemotherapy, and I gotta lay down. It's chemotherapy, rest for a couple days, go back to doing what you need to do. Chemotherapy, rest for a few days, go back to doing what you need to do. All the while we're looking at how are you responding to the exercises that we're prescribing. And exercise again is part of the medicine that you're going to get in the treatment of breast cancer. Like any medicine, exercise needs to have the right dose, it needs to have the right frequency, it needs to be monitored, it needs to be adjusted. And those are the things that physical therapy brings to the table to help women through this experience.